Pulmonary embolism. There is no way to have one unless you had a DVT first. There is no way to have a pulmonary embolism unless you had a DVT first. So at the top of that page should be DVT. Because ain't no way in hell you're going to have a pulmonary embolism unless you had a DVT first. Now, that means that somewhere in your patient's arm or leg was straw. What was the S for straw? Swelling. And what was the T? Tender. What was the R? Redness. And then the W? Boom. Okay? Who gets these damn things? Surgical patients. Your post-op patient, number one complication is going to be this PE. What you want to remember when we're talking about post-op patients is they got two whammies against them. Number one, they had damage to tissue purposely. That's what we did. We cut into their tissue. If you cut anybody, you activated platelets, yes? Platelets clump and clot and cause a clot on purpose. That's a good thing. But if the patient's post-op, now they have platelets aggregating, you can see at the bottom, it says post-op is one of your risk factors. That's number one. Do y'all see that in your chart? You have a post-op, it should say, in your chart. Hopefully you're highlighting that, not looking at me like I'm crazy. Okay, so post-op is number one risk factor. Would it be safe to say if you're post-op, you're not moving well? So the next risk factor in order is immobility. That's number two. It ain't number one, it's number two. It's in the box already. Now, here's the third risk factor. Obesity. You have more surface area to get the blood circulating through. Blood that has more surface to cover is going to move slow. Slow blood clots. Number 4 risk factor that is kind of hidden on this sheet. It says together, because both of them make up the 4th risk factor, it says postpartum/oral contraceptives. In other words, birth control pills, any kind of estrogen containing birth control, as well as a patient who just had a baby. That's all one big risk factor called estrogen. Estrogen goes with both of those. Now, if you wanted to add one just for the road, put smoking. So smoking is your 5th risk factor. So here's what we're saying. Listen to how you want to understand it. The cause of a PE was a DVT. The risk factors for a DVT in order of riskiness is surgery, immobility, obesity, and estrogen, with smoking as the last one. So every single one of these patients, you're going to want to be watching. Who is your perfect storm? The postpartum mom who had a C-section, who also smokes and was obese before she got pregnant. That was my patient, 585 pounds, and then a C-section. Fuck me. I was like, I'm screwed here. She's going to die. Just by God's grace, she didn't die, because that was a perfect storm. 585 pounds. Oh, my God. I convinced her to have surgery, the bariatric surgery. She's fine. Totally fine. All her little problems gone. It cures everything. Diabetes, hypertension, GERD, sleep apnea, arthritis, everything it cures. She's fine. I told her, your daughter will never see, she'll never see you for the first day of kindergarten. It's how I told her. She'll never ever see you the first day of kindergarten. So that convinced her. Okay, just get the damn surgery because you're a nightmare here. Now, if you look at this pulmonary embolism and you look at this sheet, oh my God, it's the holy hookup. It's your entire exam. If you ever had a question, it's going to come right up off this page. So here we go. We dealt with the risk factors. We talked about the cause. Now look at brother man. Do you see where the clot started? Hopefully you can color it. It's down in his leg. Everybody see it? Okay. It says emboli on the way to the lungs. What part of the lungs? I think it's important for you to know. Pulmonary artery. Very important that you know that. Pulmonary artery. Not pulmonary vein, pulmonary artery. Okay. How did Broadman look like after he got a clot? Well, he had the respiratory song. Tell me what a respiratory song is. They're on here. Some of them are on here already. Okay, so there's one. You see the hypoxia? You got a PO2. Yep, there you go. How about that tachypnea? Y'all see the tachycardia? Okay, you see the dyspnea? See, so you got a respiratory song here. Could you add restlessness? Hell yeah. Okay, so you could do any number of those things. Now, this patient with all of this hot mess, dyspnea, hypoxia, tachypnea, tachycardia, if you go on the left-hand side over there by the knife, you'll see the chest pain. If you look at his left hand, you'll see the disgusting tissue that he literally coughed up blood. That's what hemoptysis means, coughing up blood. Everybody see that? Okay, so those are the two things that distinguish this from other shit. You're going to have hemoptysis, you're going to have a chest pain situation here. What is the nurse going to be concerned about? She's going to be concerned about him dying, and if you look at the labs on the floor of the patient's hospital room, they drop the lab slip. What kind of gases are those? Because you know you got a couple gases. Respiratory alkalosis. The pH is high. What did that tell you? Alkalosis. The PCO2 is low. So anytime you have a patient with a high pH and the CO2 goes the opposite way, that's called Rome. Opposites are always respiratory. So the pH and the CO2 are opposites. If they're opposites, it's always a respiratory condition. You will not need compensation on this one. You won't need to know compensation, but you better believe you better know Rome. Rome is respiratory opposite, which means the pH and the CO2 only. Those are the only two values you look at. And let me just, for the sake of shits, kicks, and giggles, remind you what's going on up in here. The pH normal, 7.35 to 7.45. Do we agree? Yes. This way is alkalosis, yes? Yes. This way is acidosis. Yes. Now, the only other number you need for this exam is CO2. CO2 is the same thing as the pH. Just take the 7 and the decimal point off. Boom, take them off. Now, if these two are opposites, meaning one is high and the other is low, don't matter which way they went, just one is high, one is low. It's a respiratory condition. If they are the same, both high, both low, then you're going to have a situation where the patient is in metabolic. How do you know whether it's acidosis or alkalosis? Don't ask me nothing stupid. It's up here. So you would know that already. You just have to figure out, is it opposite? Are they opposite of each other? Is one going one direction, one going the other one? Boom. Then you're going to have Rome, respiratory. So Rome is simply R-O-M-E. Respiratory opposite, metabolic equal. I would write Rome right by that gas. Okay? Just so you don't be doing dumb stuff. This is going to take you fast. But no, let me correct that. 0.5 seconds to figure out on this exam. You got two. Just two answers right off the grid. Okay? Now, let's look at this treatment that you concocted. You see the TPA? Does everybody see the thrombolytic therapy? Put TPA. It's in the IV. See at the top? By the IV? Highlight that bad boy and put clot buster, TPA. What else did you give them? You chased it. How long did you wait between chasing it? 24 hours. What did you chase it with? Heparin. There you go. That's on the picture. This picture speaks 1,000 words. Shh. Okay, so you have your TPA, you have your heparin, you did chase it more than 24 hours later. If you look at the very next page, it even tells you how you diagnosed the situation. I want you to highlight on this picture that you have in the box, diagnosis is done with a VQ scan, and then I want you to add CAT scan in the box. CT and VQ. CT and VQ. Now look at this picture. You see the clot. You see it going. This is the best handout. I wouldn't give you two just to waste your time. If you can look with me, mine is shaded, yours is not. If you look with me, they done took this brother's thighs off and his groin. Don't worry about it. They took his arms, Shaq Daddy say don't worry about it. Okay, so look, let's follow the clot. Guess where we're going? Check this out. Leg, thigh, groin, all of that shit. What is this structure? It's a it's a vena cava. This line right here, this track. This is the inferior vena cava, superior vena cava. Some of y'all ain't even on the damn page, which is going to get you in trouble. Stay with me, because you be the one that don't know. Now, so this is the vena cava, this one right here. Superior, inferior. The inferior vena cava drains all your lower extremities. Superior vena cava drains your head and your arms. That's going to be important in neuro. So superior, inferior. If it was in the leg, this clot is traveling up the inferior vena cava. Check this out because you got to really, really study with me. It goes in through the vena cava, and look where the writing is. It says right atrium, because you guys know that blood moves from right to left. Highlight right atrium. Then you got a valve. We say try it before you buy it. So what kind of valve is that? Tricuspid. Go a little bit further down. Right ventricle. Now watch this. Go up again. That's the pulmonary artery. That little loopy flappy thing is a valve. But this is the pulmonary artery that this clot is entering into. As it enters the pulmonary artery, essentially, this big thing that looks like a liver is a lung. There's another one over on the other side, but you can't see it because it's off the page. But there's a lung here. So it goes up the pulmonary artery into the lung. And that's when your patient says, I can't breathe. And it's sometimes so violent if it's a big clot. And so there's a lady at my church. I go to a really big church, the Word Church. Her last words in the ambulance says, her brother tells me, Shelly, the last thing out of her mouth was, I just can't catch my breath. And she was gone. Because this was a big clot. She was 33. It was birth control. Now, she was obese as well, so she had some risk factors. But anyway, my point is, the shit happens, okay? So you can see the clot is all the way to the lung. This VQ scan real quick, because you're going to your lunch in 4 minutes. The VQ scan, let me explain. The V is for ventilation. The V is for ventilation. It's a 2-part scan. Ventilation. Don't ask me why. Somebody missed the alphabet. But the Q is actually perfusion. Don't ask. I don't know what the hell that was about. I don't know. So it's called a VQ scan. This is a 2-part exam. It is a nuclear scan, which means pregnant women can't get it. So the V is going to be the patient is told to inhale a gas. The gas is colored. It's a dye. So it has a color attached to it. Perfusion This is where the nurse has put in an IV. What does the V stand for on IV? Intravenous, okay? That's where she's going to put another dye. So let's talk about how the VQ scan will have a mismatch. Here's how this is going to go, because it's going to be different for ARDS, which is why you give a shit. For this patient, the inhaled gas, ventilation was not an issue for the patient. So I will see the inhaled gas in the lungs. It was actually perfusion. So when the nurse put the dye in the vein, let's follow our veins. That's why Big Mama meant something earlier. We follow Big Mama's veins. Let's follow this, ladies. We put the dye in the vein. That vein became the vena cava. The vena cava led into the right atrium. That dye continued down through the, try it before you buy it, tricuspid, right ventricle. When you get to the pulmonary artery, all of a sudden the dye stops because you have a mismatch on perfusion and your ventilation was fine. The mismatch was on the perfusion, because who's in your way? A clot. So you don't have no more dye when you got to the clot. Don't that make sense? It's a VQ mismatch on the perfusion. Now, real quick, when we talk about ARDS, ARDS is the opposite. With ARDS, I told you, you gave the patient oxygen and it tried to get to the lungs, but it couldn't, because when you come back, I'll be telling you how ARDS means collapse of the alveoli. So that gas never made it down to the alveoli. ARDS didn't have shit to do with no perfusion. So when you put the dye in the vein for ARDS, it went all the way through. You could see it all the way through. Because we had no problem with no clot, no pulmonary artery with ARDS. We had a problem with ventilation. There was no gas exchange in the alveoli. It was a mismatch on ventilation. ARDS, mismatch. Pulmonary embolism, mismatch. I don't give a shit which mismatch you got. Your first nursing action with any mismatch on this exam is O2. O2 is your first nursing action with either mismatch. Either one. Now you got a half hour to figure out how the hell you're going to stuff some down your throat and get on back in here to finish all this so crazy.